A report on respiratory illness in this country is shedding light on a surge in cases in Canada's most vulnerable. Data shows flu-related hospitalizations for kids 4 and under spiked dramatically between 2022 and 2023. CTV's medical expert, Dr. Marla Shapiro, is here now with more to talk about this. And thank you, as always, for joining us, Doctor. And some frightening numbers, a huge spike.
A huge spike. So when we think about last year, this time, we were reporting about RSV in kids. That was really overwhelming our medical system. And flu was beginning to make a comeback. If we look at what happened then last year, as a predictor of what we're seeing this year as well, there was a massive surge. And where we saw that surge is in children under the age of 4. So if you look at children under the age of 4, there were close to 2,500 kids that were admitted with lower respiratory infections. Those numbers doubled. So lower respiratory infections are always more serious than upper respiratory. COVID-19 stays rose by 43%, a really dramatic number. And then if we look at 17 and under, the pneumonia stays actually tripled, and we're talking in hospital, and the asthma stays nearly doubled. And when you ask, well, why would that have happened? Typically because there's a flu-like or influenza-like illness that sets you up, and then you get that secondary bacterial complication of pneumonia, or if you're an asthmatic, you get a terrible asthma flare that actually requires you to be admitted to hospital to get it under control.
Why do we see such a spike? Was it a return to normal?
It's a return to normal. When we look at what happened in that, when we had all the social distancing, the number that's 2,500 now was 33 in children under the age of 4. So it's massive in terms of what we've seen. So, we retrospectively look back and say, of course, social distancing worked and masking works and washing our hands work, but that's not a way that we can go forward in life. It also speaks to the fact that we've gotten quite complacent about vaccinations in children and in our young adults who don't see themselves at risk. If we look at last year's rate of uptake of 65 and older for flu shots, it's about the same. The messaging to adults you're at risk is there. But the younger population that doesn't see themselves at risk, and clearly they are, the uptake is not there.
And is it because of the vaccine hesitancy and all the concerns?
I think it's all of that. I just think there was so much, vaccine fatigue with COVID. And COVID now, we tell you, stop counting the numbers. Think about, are you up to date? Flu shots, are you up to date? It's an annual vaccine because the flu changes. It shifts and drifts from year to year, influenza A and influenza B. I just think that people sort of, I've had enough with this, but clearly it hasn't had enough with us.
And one of the big ones, RSV, the vaccination for that is kind of looking like a one and done for now, at least.
Well, we have a vaccination that's for older adults that's been approved in Canada, and we also have a vaccine that's been approved but not yet on the shelves for pregnancy to protect newborns that are born in that high-risk season. So far, the data is showing that these vaccines are lasting at least 2 seasons. We'll see if it lasts longer, but those are the 2 age populations that we're looking at. And it really is messaging about the importance of what you can do to prevent. If you look at what's happening this year in flu, if we look at the data that we've had released in terms of the numbers, we can look at what happened from August to about now. We see that increase as well in terms of the numbers of people that are coming into hospital. And we're seeing, again, older adults being affected, younger kids being affected as well, back to the pre-pandemic numbers. And there's something you can do about it. Flu vaccine. Vaccine.
And with the hospitals, how are they handling it?
So look at this. These are the numbers that we've seen from August until about last week or so. We've had over 3,600 flu-related hospitalizations. About half of them are in adults over 65. That means everybody else is the rest. And if you look at the numbers, if you're looking at 65 and older, it's about 119 per 100,000 people actually who get the illness end up in hospital. That's a big number. And 72 per 100,000 people for kids 5 and under. So the numbers are not small at all. We're seeing the spikes back. In terms of severe outcomes from the fall till about now, we've now seen close to 600 flu-related pediatric hospitalizations, and that's from about 2,400 positive tests. So that's almost 1 in 4 are ending up with flu severe enough to be in hospital.
So the message is simple. Get your vaccinations.
Get your vaccine, stay home if you're sick, sneeze into your sleeve, wash your hands. All of those messages are completely important. But absenteeism as opposed to presenteeism when you're sick, and think about what can I do about prevention. Are my shots up to date?
Okay, Doctor, thank you as always. CTV's medical expert, Dr. Marla Shapiro.